Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So, let's take a look.
Everything you need to know about naloxone for urinary tract infections. Hey everyone, today we're going to talk about naloxone, a medication used to treat urinary tract infections that are sudden and very painful. If you've ever had a UTI, you know how uncomfortable it can be. Naloxone has two main ingredients, nalidixic acid and phenazopyridine. Nalidixic acid is an antibiotic that fights the bacteria, while phenazopyridine helps you feel less pain and discomfort. This makes naloxone very helpful for complicated urinary tract infections. So how does naloxone work? Nalidixic acid stops the bacteria from growing by interfering with their DNA, while phenazopyridine acts like a pain reliever in your urinary tract, easing that uncomfortable feeling. Now, let's talk about the dosage and how to take it. Usually, the recommended starting dose is 1 gram of nalidixic acid every 6 hours for 7 days. Phenazopyridine is usually taken at a dose of 200 milligrams 3 times a day for the first 2 days. It's super important to follow your doctor's instructions and finish the entire course of antibiotics. As with any medication, there are possible side effects. Some people might feel nauseous, have a headache, or feel dizzy. It's also important not to use naloxone if you have serious kidney problems or allergies to its ingredients. Always talk to your doctor before starting any treatment. In short, naloxone is an effective combination for treating urinary tract infections that are sudden and painful. Follow your doctor's instructions and pay attention to any side effects you might experience. Thanks for watching this video. Take care and see you next time.
If you've made it this far, let us know in the comments why you're using this medicine.